All of Germany is one big outbreak. The words of the head of the country's disease control agency as the country's leaders scramble to contain surging infection figures. On Thursday, lawmakers approved a series of new measures to battle record COVID-19 infections. The health minister is warning that soon some hospitals would be able to cope with general emergency care, and the army is preparing to fly patients abroad.
Some of them spent the week threatening to veto this law, saying it didn't go far enough. But in the end, Germany's second chamber, representing the states, caved in. And with the raise of a hand, gave the new measures their vote of approval. Not a moment too soon. Across the capital, the health minister issued a sobering update on the bed shortage in hospitals.
We are getting to a point now where we will have to transfer COVID patients not just within the same region, but to other regions within Germany, and quite possibly even abroad to neighbouring countries.
Beside him, the head of the country's disease control body compared Germany to a vessel on course for collision. It's as if a tanker is approaching a harbour wall. The tanker is moving. Although we are steering against it with full force, it will still move on for a while, and it will probably hit the wall with the side, but hopefully not the front. The warning comes the morning after Angela Merkel, in what may be one of her last acts as Chancellor, rallied state leaders to agree on new rules and called on them to use them. The situation is highly dramatic, and it will be very important that action is taken quickly, that action is consistent, and that it is enforced better. On Friday, Bavaria became the first state to invoke the new rules, announcing that bars, clubs and Christmas markets would be shut for at least 3 weeks, as well as contact restrictions on those who haven't been vaccinated. For a long time, we've taken care of the unvaccinated. Now we have to take less care of those who do not care at all. This is not fun. It's one of the hardest things to decide, but it's necessary. It becomes the first German state to restrict the private lives of the unvaccinated. The latest effort to try and ramp up the pressure on people to get the shot.
And I am joined now by Robert Stoll. He is a senior physician in charge of the emergency room at Leipzig University's teaching hospital. Leipzig is in Saxony. That's Germany's worst-hit region. Robert, welcome to DW, and thanks for your valuable time. You are on the medical front line in this pandemic. It must be a huge challenge. First, how are you and your staff dealing with the situation?
Yeah, good evening, and thanks for the invitation. We have growing amounts of patients, and we are having lots of care for them, and also there's the regular patients we always have in our emergency department, and so this is a big struggle for us right now, and the accounts are growing, and we see a lot of problems coming in front of us within the next 2 weeks.
Are some staff getting ill despite the vaccination?
Yes, we got our staff is vaccinated approximately, and the doctors are 99% vaccinated, and the nurses are 90% vaccinated. But we started vaccination in January, February, and they start losing the immunization or the immunity. And we are about to lose 2 to 5 nurses a day right now due to quarantine, due to their kids which are in quarantine, and this is also a big problem for us right now.
How is that affecting care? Are you having to turn patients away?
And not yet. We are doubling the counts of beds, and within the last week we doubled the capacity of our hospital, and all the hospitals around Leipzig doubled the capacity. But actually, we are flying on site. We got capacity for the next 5 to 6 days, and we have to decide later what other resources we can manage. But also there's a real problem to transfer patients in other regions, because the ground-based rescue service also has 22-25% loss of personnel.
Doctor, I hope you'll forgive me when I ask you this question. We haven't met before, but it sounds as if you are feeling the stress even now. Would that be fair to say?
Yes, sure. We've been seeing it coming within the last 3 to 4 weeks, and we've seen the growing amounts of patients, and it started like 1 patient a week, and then it's 2 patients a week, and then it's 1 patient a day, and now we have like 5 to 6 patients a day coming to our hospital. And it's still growing.
I mean, you're in the front lines, you're a medical professional, and yet I wonder whether sometimes you say to yourself, this is what might have been happening over a year ago. We're 2 years into this almost, and it feels almost like day one, another avalanche of patients.
Yes, this is, we had not seen it coming in that way. We trusted due our immunity, but we didn't realize that we need to booster right earlier than we did. We started boostering a little late, and we are now in the middle of boostering. But we actually see in Saxony is that all the people that are not vaccinated could not be reached yet. And we have like incidences in the not unvaccinated population around 2,000, and in the vaccinated population around 50. So this is, I think, the major problem we have to reach the unvaccinated people.
Germany's politicians have announced new measures. Will they be enough?
I'm not sure yet. They will fix the problem maybe in 2 weeks or 3 weeks, but we are not sure yet how to come over the next 2 weeks. As I told you, we have like beds sure and safe for the next 4 to 5 days, and we will see afterwards if it's getting better a little bit and if it's getting a little constant, because some people are healing faster than in the last waves, and we have to see. We are flying on sight.
That is Robert Stohr, senior physician at the emergency department of Leipzig University's teaching hospital. Best of luck, and hang in there, sir.
Thank you.